Now, I think the really interesting question is why it is that my friends in the other party have made the idea of preventing these people from getting health care their holy grail, their number one priority. The one unifying principle in the Republican Party at the moment is making sure that 30 million people don't have health care.
Right. Governor Mike Huckabee says that is not true. In fact, he's here to offer his solutions. Governor, it wasn't enough to see you all weekend. You have to help us out on Monday, too. Time and a half for you. But you have a plan. You don't just have rhetoric. What's your plan?
Well, Brian, the key thing is, and let me just say, the president was just moving beyond being disingenuous to outright dishonest. To say that what Republicans want is to deny people health care is nonsense. But what we've done, we've taken the 15% of people who don't have insurance, and in an attempt to give it to them, we've messed it up for the 85% of the people who do. We're seeing jobs cut. Here's what we need to be doing. Focus on a cure rather than just on a treatment. There are 3 stages in dealing with disease: preventing it, curing it, treating it. The ideal is to prevent it. The second ideal is to cure it. If all else fails, then treat it. Our health care system is based on treatment. We spend most of the money on treating diseases, and you know why? Because there's money to be made in treating a disease. If you cure it, there's no money to be made, and if you prevent it, there's no money to be made. Our health care system is upside down, and it needs to be changed so that when people do have health care, insurance policy, it's personal to them, right, it's portable, and it's premium-based, which means they've got skin in the game. You give somebody something for nothing, and they don't have co-pays, deductibles, and they don't have any investment, and they don't know what it costs. 90% of today's health care costs are third-party pay. No wonder the system is screwed up.
So you're saying make it personal. You also say pay for big cures. For example, in biotech, if they bring a medicine to market and it passes and it gets green lighted, they make a ton of money. That's not enough?
No. Here's what we ought to be doing. We ought to be focusing on a curative measure rather than a treatment, because most of what you're talking about, and that's important, don't get me wrong, I'm glad we have treatments, and a lot of the pharmaceutical companies have improved our lives with treatment. But what if you created within the National Institutes of Health? This is like looking at the moon project. We said in 1961 we were going to put a man on the moon, and in a decade we did it. We said we were going to cure polio, and we did it in the 50s. We said we were going to build an atom bomb in the 40s, and we did it. Where is that kind of focus, funding, and fixing it? That's what we have to do. Focus on the issue. Take 4 diseases: heart disease, cancer, Alzheimer's, and diabetes. Diabetes costs $245 billion a year. Alzheimer's, $200 billion. And that's going to be $1 trillion just in Alzheimer's by the year 2050. If we found a way to cure or prevent Alzheimer's, we're talking about $1 trillion of savings to the American economy within the next 35 years.
So you're talking about a Manhattan Project on the big diseases that are killing us and also bankrupting us.
And that has to be largely government funded, because the government is the only entity that doesn't have to have a return on investment. You put it in the hands of the private sector, like a lot of people suggest, sounds good, doesn't make sense, because there is no money long term if you cure the disease. Unless you say you find a cure and you'll get a $100 billion prize for having cured it. Now, that might turn the private sector on its head and get it going. So that would make sense, but otherwise, only the government has a vested interest, because it'll bankrupt Medicare and Medicaid if we don't deal with these huge issues that are the cost outliers in health care.
And not only do you think about the big picture, because you ran for president, you also ran a state, so you also know what it's like to try to balance a budget on every level, as well as your household. And I know how much you like to spend, so balancing that checkbook is never easy at the Huckabee house.